Hey everyone, it's Agranath here from The Right Way, and more evidence about how this government is so disingenuous. All the way through pretty much most of the pandemic here in New Zealand, the government has always been said we're taking a health-based approach based on the science provided by its health providers and so on in making decisions for the New Zealand. So when we needed to lock down, when we needed to go into alert levels and so on, it was all based on the advice of the health professionals and so on. But now as we get closer and closer to reopening all of the country, so the hard border around Auckland to disappear, it seems that the government is no longer taking advice from the health professionals and making decisions based on political decisions and pandering to the Maori population who refuse to get vaccinated. And this is being brought out actually in court, well, in a tribunal. So the COVID-19 Delta outbreak revealed the public health advice to have Auckland unshackled by now and why Jacinda Ardern, our Prime Minister, rejected it. The Auckland boundary restriction should have been lifted and the whole country bar Auckland and Northern should be in the orange setting according to previously unreleased public health advice. The Ministry of Health also initially thought some regions should start in green. Obviously they should start in green because they don't have any COVID in those areas. This government is so wedded to their ideology of not being, of trying to play it safe everywhere and not thinking it through properly. Though this was later revised due to the spread of Delta, despite its concerns that starting the traffic light system in early December could put vulnerable Maori at greater risk. If these Maori people were so vulnerable, why are they not getting vaccinated, right? If you don't want to get vaccinated, then stay in your house, don't go out. Why is it the rest of us have to put up with things because of these people? And of course, it's not just Maori people that are unvaccinated. There's a lot of other people from other ethnicities as well. But it seems that they are making the most fuss and saying that we need checkpoints to protect these people when they refuse to get vaccinated. It's utterly ridiculous. This warning was outlined in a ministry paper on November 24, 2 days after Prime Minister Jacinda Ardern had already announced the new system starting from December 3. Ardern ultimately took a far more cautious stance than the ministry, with several districts outside Auckland and Northern, Taupo, the Rotorua Lakes, Kawerau, Whakatane, Opotiki, Gisborne, Wairoa, Rangitikei, Whanganui and Ruapehu, also in red for at least 2 weeks, no region in green, and movement in and out of Auckland only starting from December 15. This goes against the health ministry advice, right? So she's no longer following the health ministry advice, she's following her own political decisions now. The public health advice is contained in Director General of Health Ashley Bloomfield's affidavit to the Waitangi Tribunal. So this was in some sort of, official setting and so on. So we can see that the government just are not taking that advice anymore. Our advice was the hard or enforced boundary around Auckland should be removed when Auckland and the rest of the country moved to the COVID protection framework, which is our traffic light system. Bloomfield's written evidence to the tribunal said, this is because there will be no public health justification to maintain a boundary around Auckland under CPF. Put another way, the boundary around Auckland has served its purpose, it has been effective, alongside other public health measures in greatly reducing the risk of the virus. So basically, there was no justification to maintain the boundary except a political decision by the government to keep it there, just to pander to all those people that refuse to get vaccinated. Now, I don't care if people don't want to get vaccinated, that's their choice. I'm not for mandating vaccinations at all, but don't hold the rest of the country to ransom if you don't want to get vaccinated. That didn't mean the virus wouldn't escape, but Bloomfield said the new framework, alongside increasing vaccination coverage, will minimise the chances of serious illness and death, both in and beyond Auckland. Maintaining the boundary will also take extra testing capacity away from higher priority tasks, including quick turnarounds for close contacts and those who are symptomatic. Exactly. Bloomfield also revealed public health advice to start some regions in green setting, likely parts of the South Island, given it would be easier to check the testing or vaccine passes of everyone travelling there rather than a place like Tarawhiti. So there should definitely be places in New Zealand which are green, but the government have the COVID protection framework, but it's up to them to decide when you move. And so there's basically no real hard and fast rule when a region goes from one traffic light to a different traffic light. It's all political decision making from now on. Our preliminary view is that the various regions could enter the CPF on green. However, given our assessment committee's concerns about the number of areas with low vaccination status, particularly for Māori, and current active cases in several DHBs, not just limited to Auckland, this preliminary view was adjusted. The final recommendation was that regions should be placed at orange except for Northern Auckland, who should enter at red. This adjustment was based on a precautionary approach and should be viewed as an interim measure for the coming weeks. Of course, they just can't bring themselves to act rationally. They just want to keep people scared, and this is one of those things. Cabinet's decision to relieve Auckland of different lockdowns, to abandon the elimination strategy and move to a new system, prompted concern about putting Māori unjustifiably at risk. They wouldn't be at risk if they would just effing get vaccinated, right? Or if you don't want to get vaccinated, then live in your house and don't go out anywhere if you're too scared to go out. Stop holding the rest of us to ransom. The rest of the article is just more about that point. We can see that the government has abandoned taking advice from the health ministry, and they're purely making decisions based on political decisions and pandering to their woke Maori caucus and their Maori voters, which they absolutely need to actually get back into power. Let me know what you think. Are you annoyed that the government is now making political decisions on COVID rather than taking advice from the health ministry? Or do you think they're doing the right thing? Love to read your comments. If you like this video, give it a thumbs up. If you don't like this video, you're welcome to give it a thumbs down. And hopefully I'll catch you in the next video. And if you like my content, please subscribe as well.